Explore new worlds and new ideas through programs like this. Made available for everyone through contributions to your PBS station from viewers like you. Thank you.
The health of your gut can impact every aspect of your body. If you're suffering from bloating, constipation, diarrhea, and abdominal pain, you probably feel like you've tried everything to find relief. Even seemingly unrelated ailments like asthma, eczema, diabetes, and arthritis can all be due to poor gut health. The daily symptoms can range from uncomfortable to debilitating, but they don't have to be. All of these symptoms and so much more are controlled by the millions of bacteria that live inside your body. This delicate ecosystem is called the microbiome, and it's essential to your health. It not only influences your overall health, but also things like your weight, energy level, and even your susceptibility to diseases.
The microbiome you woke up with today does not have to be the microbiome you go to bed with tomorrow. You are in the driver's seat when it comes to the health of your gut, and you have an incredible opportunity every single day to transform it with the choices you make.
Dr. Robin Chutkan, a renowned gastroenterologist and best-selling author, offers a groundbreaking guide to digestive wellness and a simple program to provide lasting strategies for relief. Just a few key changes can make a huge difference in your gut health and, in turn, your overall health. Better sleep, clearer skin, a boost in energy, and even a decreased risk for obesity and diabetes are all possible with the right guidance. Going beyond the basics, Dr. Chutkan empowers you to take control of your gastrointestinal wellness. And finally, find your gut bliss.
Hello, I'm Dr. Robin Chutkan, integrative gastroenterologist on faculty at Georgetown University Hospital and the founder of the Digestive Center for Wellness. I'm also the author of 3 best-selling books on digestive health, and today I am delighted to be your guide on this incredibly important journey to finding your gut bliss. My goal is to help you understand what your gut is trying to tell you, how to interpret those important cues your digestive tract gives you every single day through symptoms like bloating, constipation, diarrhea, and abdominal pain. Why is this so important? Because, as Hippocrates said thousands of years ago, and it's still true today, all disease begins in your gut. Just think about where your gastrointestinal tract is located. It's at the very center of your body. Your other organs all depend on the nutrients absorbed in your gastrointestinal tract to function properly. So when your gut isn't working well, chances are neither is anything else in your body. Did you know that difficulty losing weight, acne, unexplained fatigue, and anxiety can all be symptoms of a poorly functioning gut? In fact, your gut is so vital to your overall health that we refer to it as your second brain. As an integrative gastroenterologist, I approach gut health in a very holistic way. I'm constantly trying to figure out the root cause of my patients' GI distress instead of just prescribing a drug and hoping they get better. And that is exactly the journey we're about to embark on together. I'm going to help you figure out not just what's gone wrong with your gut, but why, and exactly how you can get it back on track. In my gastroenterology practice, a lot of the patients I see have multiple complaints: abdominal discomfort, hair loss, eczema, depression, joint pain, headaches, and much more. And while these symptoms may seem completely unrelated, the truth is they're often all attributable to poor gut health. There are so many things that can wreak havoc on your gut, from the foods you eat to the medications you take every day. And the result can be a chain reaction that affects multiple other systems in your body. Asthma, allergies, even arthritis can all be caused by problems that begin in your gut without you even realizing the connection. That's why it's so important to get to the root cause of your digestive issues and to start implementing today the steps that can improve your overall health. The life-changing information that I'm going to provide you with today will give you all the tools you need to take control of your gastrointestinal well-being and help you find your gut bliss, a digestive system that runs like the well-oiled machine it's supposed to be and supports the health of your entire body. Finding your gut bliss will make you feel light, tight, and bright, the healthy way. So let's dive right into Digestion 101. What is actually happening in your digestive tract? We eat food, it gets digested, and it comes out the other end. But what happens in between? How does it all work? And where are we going wrong? And what about this concept of the second brain in our gut? We're going to explore all that and more, including what you need to know about the trillions of bacteria that live in and on our bodies, mostly in our gut. Your gastrointestinal or GI tract is the engine for your entire body. When you eat, nutrients are absorbed through the lining of your intestines and they travel to the rest of your body where they're used for energy. This 30-foot-long digestive superhighway is a powerhouse for your body, but wrong turns can and do happen along the way, so it's critical to understand the anatomy, especially some really important anatomical differences between men and women. Women may be from Venus and men from Mars, but are our digestive tracts really that different? It turns out that they are. Women have a longer colon than men, on average about 10 centimeters longer. Now, that may not seem like much, but it can cause a lot of extra looping and twists and turns, what I like to call the voluptuous Venus colon. My male colleagues will often refer to the female colon as tortuous or redundant. But who wants to be told they have a redundant colon? Wouldn't you much rather have a voluptuous Venus colon? As women, we also have a wider, deeper pelvis in order to accommodate the fetus during pregnancy. This means that in women, the colon is located low down in the pelvis, where it has to compete for space with the reproductive organs. What else is down there? The uterus, the fallopian tubes, ovaries. Men have a much narrower pelvis, so most of their colon ends up in the roomier abdominal area. And when their colon is down in the pelvis, the only other thing taking up space is a little prostate gland. So there's not a lot of competition for room in the male colon. Men also have higher levels of testosterone, which causes their abdominal muscles to be much tighter. In women, lower testosterone levels means that our abdominal wall is unfortunately not as tight, kind of like a stretched out Spanx. That also leads to lots of looping and bloating of the intestines because you don't have that strong abdominal binder to hold everything in. Even when men are overweight and have a bare belly, they're still not bloated because underneath that bare belly, they have a nice tight Spanx. It's really unfair. These three factors, the longer colon, the wider pelvis, and lower levels of testosterone all add up to way more bloating and constipation for women. I like to say if I had $1 for every bloated, constipated woman I see, I would be extremely wealthy. So now let's talk about something that's similar in both men and women, the enteric nervous system. That's a technical term for the second brain in your gut. Your enteric nervous system contains 500 million neurons or nerve cells, 5 times as many as in your spinal cord. It functions completely independently from your brain, but it also communicates with your brain through neurotransmitters, chemical substances that send specific messages to and from the brain. In fact, 90% of your feel-good hormone, serotonin, and 50% of your dopamine are located in your gut. Your enteric nervous system can alter the levels of these neurotransmitters it produces based on the composition of what you're eating. So this is a prime example of how your diet, what you eat every day, can have a profound influence on your mood. You've probably all experienced the influence of your enteric nervous system at some point. The butterflies in my stomach I had this morning before we started taping, that's my second brain at work. And that's the reason behind the saying, trust your gut. Because there are real nerve cells, millions of them in there, helping you to figure things out, the same way your central nervous system helps you. Now, in my opinion, what we're going to talk about next is absolutely the most exciting new development in medicine today. It's what I like to refer to it as the zoo inside you. The microbiome. The microbiome refers to all the microbes, those tiny microscopic critters that live in and on our bodies, mostly in our GI tracts. Not just bacteria, but also things like viruses, parasites, fungal organisms. Your body contains over 100 trillion microbes, more than 1 billion in just one drop of fluid in your colon alone. Did you know that your microbiome is a more unique identifier of you than your own DNA? It reflects everything about you: where you were born, what you've eaten, medications you've taken, whether you had siblings or pets growing up, and a host of other factors. Unlike your genes, your microbiome is constantly changing based on your ongoing exposure to food, medication, toxins in the environment. The microbiome you woke up with today is not the same microbiome you will go to bed with tomorrow. It's constantly changing based on the choices you make throughout the day. And that is a really good thing, because our health is so closely tied to the health of our microbes. And that means we can actually improve our microbiome by making better choices. A lot more on that to come later on. So what do our microbes actually do, besides make smelly gas, that's so essential for our health? Think of your microbes as the bees in your hive. They're the ones who are actually doing all the work. They break down and digest the food you eat. They produce substances called short-chain fatty acids that keep the lining of the gut healthy, and they produce those from fiber mostly. They synthesize vitamins that your body can't make on its own, like vitamin K, a vitamin that's very important for helping our blood clot. Can't make it without bacteria. They metabolize drugs, they neutralize toxins, they maintain the lining of your gut to keep nutrients in and toxins out. They train your immune system to distinguish between friend and foe so that it's not overreacting to something benign and underreacting to something dangerous. And most importantly, they turn our genes on and off, which actually helps to determine whether diseases you may be at risk for genetically will actually develop or not. This is what we call an epigenetic phenomena. As we like to say in medicine, your genes are the gun, but environmental influences like the microbiome are the trigger that will actually determine whether the disease happens or not. These days, so many of our medical and lifestyle practices are disruptive to our microbiome. Overuse of antibiotics is a huge problem. Just 5 days of a broad-spectrum antibiotic, like the kind you may take for sinus infection, will remove up to 1/3 of your gut bacteria. Just think about that. 1/3 of the microbiome that you took all these years to develop, gone in one fell swoop. Most of those microbes are never coming back, no matter how many probiotics you take, a drop in the pan. I like to use this comparison. Having a full complement of microbes is like having a full bathtub. When you take an antibiotic, you drain out a lot of that water. So imagine pulling the plug and draining out 1/3 of the water. A probiotic is like taking a cup of water and pouring it back in. It's not the same thing. So the most important thing is judicious use of antibiotics. I'm really glad that antibiotics are around. They save millions of lives every year, but there's also no question we're overusing them. Conservative estimates suggest that as much as half of the antibiotic use in this country is unnecessary. We're using it to treat viral infections or minor bacterial infections that would get better on their own. And this has devastating consequences for the microbiome. I spend a lot of time in my medical practice trying to undo the damage from too many drugs. Gut bacteria are really fragile, and almost any medication you can take, but particularly things like antibiotics, acid suppressors, non-steroidals, hormonal therapy, those sorts of things can really devastate the microbiome. But even other drugs that we didn't think of, there was a recent study that showed that very common anti-anxiety, antidepressant medication can cause resistant bacteria to develop, resistant E. coli that can cause urinary tract infections. So as we start to put all of this stuff together, why are people having all these urinary tract infections? Why are we seeing an explosion of autoimmune disease? Again, most diseases do not fall from the sky. There is a thread. And what we're starting to do is we're starting to put the pieces together. For example, if we look at a condition, a set of conditions in the gut like diverticulosis, hemorrhoids, and constipation, they're all caused by the same thing: not enough dietary fiber. all caused by the same thing. And the same thing microbially, if we look at somebody who's suffering from hypothyroidism, has celiac disease, and bloating, it's often all caused by damage to the microbiome, imbalance, microbial imbalance. Yes, there can be other causes for some of these conditions, but for all of us as consumers, we have to ask these questions. We have to be skeptical when we're taking all these multiple medications and really make sure that everything we're taking is absolutely necessary and that we're not taking something that can be working at cross purposes and actually hurting our gut. And we have to try and connect the dots to try and understand, why do we have 6 things going on? Why is our hair falling out? We're exhausted, we have rectal itching, we can't have a good bowel movement, and our joints hurt. What's the likelihood that there are 5 different diseases going on versus a possibility that there's one common thread? And the wonderful thing is, when you start to play medical detective and try and figure this stuff out, hopefully with the help of your healthcare practitioner, you can start to sort of knock the dominoes back up. The dominoes have all been knocked down, you're gonna knock them all back up. So you can improve so many different aspects of your health. And again, not always, but so much of the time, it's all emanating from the gut. So you have to really look at these things, the medications you're taking, the food you're eating, your practices, are you being a camel and drinking no water? All of these things, and see, how is that affecting my gut? And then how is my gut affecting these other organ systems, my thyroid, my joints, my kidneys, etc. So important to try and tie it all together. And it's not just the antibiotics that you take from the doctor. Did you know that more than 3/4 of all the antibiotics in the US are used in the food industry to treat the animals we're eating? So even if you're being really careful about not taking antibiotics from the doctor, you may still be exposed through the food you're eating. Acid suppressors are another menace to the microbiome, and yet they're amongst the most commonly prescribed drugs for digestive problems. You cannot get out of a gastroenterologist's office without being handed a prescription for one of these drugs. Chances are many of you are on one or more of these acid-blocking drugs and maybe have been for years. But it's important to know that stomach acid is one of the main defenses against bacteria that enter our body through the mouth, against undesirable bacteria. And when you block stomach acid, as these drugs do so effectively, you end up with overgrowth and imbalance of bacteria. And that can lead to really serious problems down the road. Because abnormalities like this in our microbiome, this sort of imbalance, has been linked to multiple different disease states, including asthma, allergies, autoimmune diseases that 50 million Americans suffer from, heart disease, depression, Parkinson's, diabetes, and even some forms of cancer. In fact, changes in our microbiome may even be making us fat. Certain types of bacteria are more adept at pulling calories out of food, at changing what we call the energy harvest. And if you have a lot of these bacteria, that can result in more weight gain for the same amount of food. Researchers at Wash University in St. Louis took microbes from identical twins, where one twin was normal-sized and the other twin was obese. They transplanted the microbes from each twin into germ-free mice who were normal size. And guess what happened? Sure enough, the mouse that received microbes from the obese twin started to gain weight with no change in diet or exercise. So if you're one of the millions of people who struggle with your weight, the answer may be much more complicated than simply calories in versus calories out. What's going on in your microbiome may play a huge role in determining how easily you gain or lose weight. So how many people in the audience count calories? Let's see a show of hands. Most of us, right? What if I told you calories were a completely artificial construct? Calories are designed to get you to buy low-calorie, low-nutrient density food, low-calorie junk food. Because you're standing there and you're like, well, these cookies are only 120 calories, but this oatmeal is 300 calories, or this salad is 400 calories. What determines whether or not you put weight on is not the calories. It's what the bacteria do with the food once it gets into your body. And if you're eating high nutrient density, high fiber food, Your gut bacteria are converting that to short-chain fatty acids that's actually keeping you healthy. When you're eating even a small amount of low-calorie, but junk food, high glycemic index, very processed, that causes insulin levels to rise. And insulin is a hormone that causes all of this to be stored as fat. In addition, that's not useful food, so it ends up just getting stored as fat in your body. I want you to stop looking at the calories, and I want you to start thinking about what it is you're eating. The calories are just a way for the manufacturer to pull you in, to eat their processed junk. Look at the food, look at the sweet potato, look at the rice, look at the piece of chicken, look at the bunch of spinach. This is what a whole food is. A whole food isn't something in a package that has a whole bunch of complicated nutritional information on the back. So forget about the calories and eat food that makes you feel good. Remember we talked about the neurotransmitters, the serotonin? When my daughter's eating a kale salad, my serotonin levels go up. So eat food that makes you feel good, that makes you feel joyful, that makes you feel that you can feel that you're doing something good for your body. And forget about those calories. It's like diet soda. Diet soda is a great example of nutritionally empty, low calorie, in fact, 0 calorie food sometimes. And if it's got 0 calories, what's actually in it? That should make you very suspicious. What kind of chemicals are 0 calorie? And what we know is that diet sodas are as big, if not a bigger risk factor for diabetes. Because even though it says 0 calories, diet soda is plenty sweet. And insulin levels rise in response to sweetness. And so if you think about that 150 calories or so of a regular soda, the 0 calorie soda is probably causing just as much weight gain. 150 calories a day, I used to be able to do this math in my head really easily. 150 calories a day times 365 days, it's somewhere around 55,000 calories divided by 3,500 calories equal a pound. That's about 16 pounds a year from one soda or diet soda a day. So if you can do anything, subtract the soda. Imagine for a moment what would happen if your brain stopped functioning. All the systems in your body would shut down. As a second brain, your digestive system is just as connected and vital to the systems throughout your body. And the trillions of microbes that live in your gut have a lot to do with this interconnectedness. So it's absolutely essential that you prioritize your gut health just as you would your brain health. That's exactly what we're going to learn more about next, some invaluable information on what can go wrong in your gut, as well as some of my tried and true tips to keep things moving and prevent those traffic jams on your digestive superhighway. Symptoms like acid reflux, constipation, and bloating can range from uncomfortable to debilitating, but you don't have to suffer. Coming up, we'll explore what's gone wrong in your gut and my favorite Gutbliss remedies for real and lasting relief. We're going to get even more intimate with our gastrointestinal tract and answer the burning question that you all have. What's gone wrong with your gut and how can you fix it? If you're suffering from symptoms like acid reflux, bloating, or constipation, you probably feel like you've tried everything to find relief. You may be taking multiple medications, you may even have turned to a surgical solution. But what if I told you that there are some simple steps you can take to solve the problem from within? It's all part of your journey to gut bliss, discovering the real cause behind the reflux symptoms that millions of people suffer from, figuring out if the missing link in your digestive distress could be caused by gluten. Do you have potholes in your gut you don't know about? And if you've been told you have irritable bowel syndrome, what exactly is irritating your bowels? Let's start with an issue so many people suffer from: traffic jams on their digestive superhighway. The GI tract is one long road from start to finish. There are no shortcuts, bypasses, or alternate routes. And unfortunately, there can be plenty of obstacles along the way. There are many, many factors that can slow things down and cause your digestive contents to get stuck in transit. One of them is constipation. It's one of the commonest complaints in my practice, and honestly, one of my favorite things to treat. Why? Because there's almost always a satisfying solution. When you can give somebody what I like to call stool nirvana, it's fantastic, not just for them, but for me as a doctor. When they come in and they're bright and light, it's wonderful. What I want you to know is that constipation is a symptom, not a disease. Remember those cues your digestive tract gives you that I talked about at the beginning? Well, constipation is one of them. It's a sign that all is not well in the gut. But again, it's a symptom, not a disease. And my goal is always to figure out the cause. And there can be multiple causes. Something as simple as dehydration is a really common one, as is not eating enough fiber or not getting enough exercise. As I'm fond of saying, if you're not moving, neither are your bowels. Medications are another really common cause of constipation, especially pain medications and antidepressants, but even supplements that contain calcium or iron can really slow things down. An underactive thyroid gland can also really slow things down. You may be suffering from hypothyroidism and not even realize it. So can diabetes, scar tissue in the abdomen from previous surgery, and something we call colonic inertia, where your digestive superhighway turns into a slow country lane. Everything gets slowed way down. So here are a few of my favorite Gutbliss remedies for getting regular. The first is eat more indigestible plant fiber. Fruits, vegetables, nuts, seeds, beans, yams, all great sources of indigestible plant fiber. And remember to eat the skins and the stems whenever possible. Don't break off half the asparagus or throw away the broccoli stems. That's actually where most of the fiber is located. It's this type of indigestible fiber that isn't broken down and absorbed that helps to bulk the stool, and it also feeds your good gut bacteria. So what you're not eating and absorbing is going on to feed your bacteria. And that's a kind of fiber that you should be focusing on, not processed fiber from baked goods and junk food. So if you're eating a lot of things that are supposedly high fiber, that are packaged and tell you how many grams of fiber, I want you to put those aside, and I want you to eat fiber from the ground, root vegetables, plants, fruits, nuts. That's really what I want you to focus on. You may also need to take a fiber supplement like ground psyllium husk. You need to mix it with a lot of water, but it can be super helpful in getting things down to the finish line. And speaking of water, drink more. I'm essentially a plumber. And when my clients' pipes are clogged, I have them run a lot of thin liquids like water through them. Aim for 8 glasses a day. It will work wonders in the bathroom and for your skin. The other thing I want you to consider is taking a really good look at your medicine cabinet. Check for things that could be hindering rather than helping your transit time. Not just the drugs we mentioned earlier, but also supplements or over-the-counter cold medications. Those often have things in them that can slow things down. Just be sure to check with your doctor before changing anything. Another really important tip for getting things moving is to develop good bathroom habits. You would be amazed at the number of people who take the newspaper in, they take their phone in, they take their computer in. You are simply training your bowels to take all day to empty. When you go in there with all your stuff, with your briefcase, you are saying to your gastrointestinal tract, we got all day. And that is exactly what happens. It takes all day. I want you to get in and out as efficiently as possible, like a strike, in and out. No lollygagging in the bathroom. The other super helpful thing in the bathroom is to change your position. Try elevating your legs up. Old telephone directories work great for this because what else would we use them for? So when you pull your legs up towards your waist, you adjust a muscle internally called the puborectalis muscle that allows the sphincter to open and expel the stool. If you're bendy like me, I do yoga, you can pull your feet all the way up and actually put them right on the seat in front of you. But be very careful not to topple over. It can happen. When you change this angle, though, and bring the legs up, you also increase the intra-abdominal pressure, and that helps to push things down. So the mechanics of this can really make a difference. For those of you who really struggle with having a bowel movement, you could have something called anismus, where the muscles contract instead of relaxing, making it difficult for things to come out. Biofeedback, a technique where you learn to consciously control the muscles through relaxation techniques, guided imagery, and meditation, can be life-changing for having stool nirvana. Now that we've tackled getting regular down below, let's turn our attention to the other end of the GI tract. Acid reflux, or GERD, gastroesophageal reflux disease. GERD is generally caused by inappropriate opening of the lower esophageal sphincter, that little muscular valve that connects the esophagus and stomach, and not because of overproduction of acid, as so many people think. Millions of people didn't all of a sudden start overproducing acid, but many of them are doing things every day that can lead to that sphincter opening and acid reflux. One of the common things that they're probably doing is overfilling their stomach. When it's empty, your stomach is about the size of my fist, not very big. And when it's full of food, it can only expand to about this size. Most of us are eating a lot more than a fistful of food, and chances are you're eating more than a fistful of food late at night, especially dinner. And that brings us to another major cause of reflux, eating too late. Did you know that your stomach has a bedtime? Its contractility is tied to the light-dark cycle, something we call the circadian rhythm. It's most active in the morning when the sun rises and least active at night after it sets. And unfortunately, that's when most of us tend to dump in many, many calories. And that's why people tend to have reflux symptoms at night or in the early morning. A high-fat diet is another big one. Fat is a lot harder to digest, and when the stomach receptors detect a high level of fat inside, they send a chemical message to something called a gastric pacemaker, a bundle of nerves that controls stomach emptying. And the gastric pacemaker then slows everything down so that there's extra time to break down the fat. But this extra time also means extra opportunity for that fatty meal to linger in your stomach and come back up into your esophagus instead of going down into the intestines. Caffeine, alcohol, and nicotine can all cause that lower esophageal sphincter to open, so they're all major triggers for acid reflux. And so is a sedentary lifestyle, sitting too much, because not moving enough also slows down movement of your stomach. And again, you heard it from me, if you're not moving, neither are your bowels. So, if you're fond of eating a burger and fries and having a couple drinks at night and then plopping down on the sofa, you're almost certainly going to have reflux symptoms. I'm getting heartburn just thinking about it. Lifestyle modifications are still the cornerstone for treating acid reflux, and that's really what you should be paying attention to before considering medical treatment. In addition to cutting back on alcohol and caffeine and hopefully quitting smoking altogether, calorie shifting, where you eat your larger meal earlier in the day, can make a huge difference. Breakfast like a king or queen, lunch like a prince or princess, and dinner like a pauper is what I recommend. Now, let's move a little further down the GI tract to the small intestine to tackle an increasingly common problem. Celiac disease refers to an allergy to gluten, a protein found in wheat, rye, and barley. These days, it seems like everyone is on a gluten-free diet. But could gluten be the missing link between what you're eating and how you're feeling? As I mentioned, celiac disease is an actual allergy to gluten, and it results in real damage to your small intestine, where the villi, the finger-like projections in your intestine where the food is actually absorbed, become flattened, which can lead to malabsorption, and it means that you can't absorb nutrients from your food properly. People with celiac disease may have anemia, and they may be low in iron and other essential vitamins as a result of this malabsorption. Gluten sensitivity, on the other hand, means that you have symptoms when you eat gluten, but as far as we know, there's no actual damage to your intestine that occurs when you eat it. About 1%, a little over 1% actually, of the population in the US has celiac disease, but millions more are gluten sensitive, and many don't even realize it. The symptoms can range from mild bloating to debilitating cramping, diarrhea, brain fog, joint pain, and fatigue. From an evolutionary perspective, processed gluten-containing grains are a pretty new phenomena in our diet, and for many of us, our intestines just aren't adapted to digesting them. Hence this rapidly rising number of people with celiac disease and gluten sensitivity. If you think you might have celiac disease, there's a screening blood test that your doctor can order. For gluten sensitivity, try eliminating gluten-containing foods for a few weeks. You never know, your gut might actually thank you. Now back to our digestive superhighway to talk about one of the commonest problems for people over 50. In fact, more than half the population over 50 suffers from this. I'm talking about diverticulosis, those little pockets that develop in the lining of your colon that can leave you chained to the bathroom. Diverticulosis is caused by a diet that's too low in fiber. The colon has to work really hard to push out those small, stingy little stools that are typical, unfortunately, of a low-fiber Western diet. And the result is that these pockets develop, especially down in the sigmoid colon, the part that sends a stool down to the rectum and has to work really hard. If you have diverticulosis, chances are you're experiencing discomfort or cramping in this lower left part of your abdomen, which is where the sigmoid colon is located. Incomplete evacuation, where you can feel that you haven't completely emptied, is another common symptom. And again, so many people describe these multiple trips back and forth to the bathroom with very unsatisfying small pellets coming out each time. So how do you get relief if you have diverticulosis? Like so many other problems in the digestive tract I've talked about today, you increase your dietary fiber. Diverticulosis is common in people over 50, but this next topic is the most common GI condition. 15 to 20% of Americans suffer from irritable bowel syndrome, or IBS. IBS causes abdominal pain or discomfort that's usually associated with constipation, diarrhea, or both, what we call alternators, and virtually everyone complains of bloating. It can dramatically decrease your quality of life. If you've been diagnosed with IBS, it's really, really important to look for the root cause so you can actually fix a problem rather than just treating the symptoms. While stress can be a trigger for some people with IBS, many have undiagnosed conditions like lactose intolerance, fructose intolerance, parasites, Crohn's disease, bacterial overgrowth, and many more. It's a long list. It's so important to find a practitioner who will work with you to help you figure it out and not just prescribe a medication that may or may not be effective. Again, it's all about finding and alleviating the root cause. Now that you understand some of the common things that can go wrong with your gut, you're in a much better position to find strategies that can actually improve not just your gut health, but your overall health. Coming up, we're going to talk about how diet plays a major role in your gut health. I'm going to tell you about some fascinating nutrition studies that prove that big changes can happen in as little as 2 weeks. When you understand how vital your gut is to your overall health, it's extremely empowering. It's reassuring to finally understand what's happening inside your body, where things may be going wrong, and to know that lasting relief is within your reach. I'm going to build on all of that and tell you exactly what you need to know to achieve gut bliss, how to banish your bloat, flush your toxins, and dump your digestive baggage the healthy way. Let's begin with a tale of two cities, Florence, Italy in Europe, and Bulpan, Burkina Faso in Africa. We're traveling really far, all the way around the world. Dr. Paolo Leonetti, an Italian researcher, studied the microbiome of babies in Italy, in Florence, Italy, and another set of babies in Bulpan, Burkina Faso. All the babies were born vaginally and breastfed. And that's really important to mention because those two factors are very important early factors that can affect the microbiome. But these babies were the same. And in truth, at birth and throughout infancy, these babies were virtually identical in terms of their microbes. But as soon as they started to eat the local diet, everything changed. The Italian children were eating a diet high in fat and sugar, lots of pizza, pasta, meat, and gelato. Almost identical, in fact, to the standard American diet that most kids are eating here. The African children were eating a locally grown, plant-based diet, enlivened by the occasional termite or free-range chicken. And that was really their source of animal protein once a week or so. The microbiome of the children reflected these differences in their diet. The African kids had high levels of those important short-chain fatty acids we talked about that help keep the gut healthy. They also had really high levels of the bacterial species that are associated with leanness and with overall health. How about the Italian kids eating the Western diet? They had much lower levels of short-chain fatty acids, and unfortunately, they had a lot of the species that are associated with obesity, inflammation, and diarrheal illnesses. Now, it's really important to note that neither group of children were sick. They were all in good health. They were young, but the Italian children already at an early age had a microbiome that predicted disease, that put them at risk for developing all sorts of problems down the road. The African children, they had a microbiome full of species that were protective against disease. So you might think about this and say to me, that's very interesting, Dr. Chatkan, but Bulpan, Burkina Faso, and Florence, Italy, aren't just different in terms of the food, they're also very different environmentally. And maybe it was actually those environmental differences that we were seeing reflected in the changes in the microbiome as the kids got older. So, to answer that, we're going to look at another study that was published in the journal Nature in 2014. Researchers took 9 volunteers and they put them on 2 different extreme diets for 5 days each, the same group of people. The first diet was a high-fat, low-fiber diet, brisket, salami, prosciutto, and cheese. Are you getting some heartburn thinking about it? Then they rested those same 9 people for 5 days, and they then put them on a low-fat, high-fiber vegan diet. Jasmine rice, lentils, onions, tomatoes, squash, peas, and for snack fruits like bananas and mango. They studied the microbiome before, during, and after. And what they found was astounding. Within about 30 hours of the food hitting the gut, the microbes shifted dramatically. The bile-loving species, what we call biophilia, that help break down fat, but unfortunately are associated with things like inflammation and colitis, they dominated on the high-fat diet. What was even more astounding than the microbial changes were the changes in the genes that were turned on and off, and how rapidly this all happened. This is another stunning example of how changing your diet can change not only your microbiome, but can actually change your genes, and therefore can alter your risk down the road of developing disease. The last study I want to mention was a very clever study that involved an international team, including students from the University of Pittsburgh here in the US and Imperial College in London. They did research with a group of 20 African American volunteers and another group of 20 Black participants from rural South Africa. The 2 groups swapped diets under tightly controlled conditions for 2 weeks, so they were very clear about what they were eating. The Americans eating the African diet did great. They had increased levels of those important short-chain fatty acids. They shot up, and they had less inflammation in their colon after just 2 weeks. They also had reduced biomarkers of cancer risk. 2 weeks is too short to tell whether there was a change in cancer, but there was a decrease in cancer risk based on these substances they were measuring. The African group on the American diet, they didn't fare so well. They had a dramatic increase in their cancer risk after just 2 weeks on a standard American diet. So what were the rural South Africans eating that was so helpful in producing those high levels of short-chain fatty acids and protecting them from cancer? They were eating MACs, Microbiota-Accessible Carbohydrates, MACs. High fiber, plant-based foods that you might eat every day. Whole grains, oats, beans, nuts, seeds. What I want to remind you is that it's what you're missing in your diet that really counts. It's not about never eating a piece of meat or having a slice of pizza. It's a fact that most Americans get less than 12 grams of fiber a day, instead of the recommended 25 to 35 grams. If you want to be healthy, you have to focus on creating a healthy microbiome. That means feeding your gut bacteria lots and lots of plant fiber. Food is powerful medicine. A high-fiber diet doesn't just give you better bowel movements. It can actually protect you against serious diseases. Achieving gut bliss should be easy now that you understand how your gut works, what can go wrong, and the critical importance of microbial balance. Remember, the microbiome you woke up with today does not have to be the microbiome you go to bed with tomorrow. You are in the driver's seat when it comes to the health of your gut, and you have an incredible opportunity every single day to transform it with the choices you make. When I'm talking to my patients about what to eat, which is probably the most common question I get, what should I be eating? I try to paint this picture for them. Imagine food as something that was once alive, that came from a tree or the ground or was caught in the ocean or hunted on the land. So something that has a beginning, middle, and an end. When you look at an apple, you can see, okay, this came from a tree. When you look at an apple fruit roll-up, that was made in a factory. So try and think about food that came from nature versus food that came from the factory. And even within the same kind of food, again, so an apple, nature, applesauce, factory. Potato, nature, potato chip, factory. It's amazing how far you can go with this. So not just whether you're eating a potato or not, but what form you're eating it in. And try and eat more food from nature. You also need to think about where the food came from. Because where do we get our microbes from? At birth, we get them from our mother, those of us who had the good fortune to pass through the birth canal and get colonized with all those healthy microbes. But after that, we get our microbes mostly from the food we eat and the environment. So if you're eating food that's assembled in the factory, you're not getting any good microbes there. You need food that had dirt on it at some point. In fact, when I go to the supermarket and I see these carrots that are perfectly orange and they're exactly 5.5 inches in length, and there's no dirt on them, I'm really suspicious. I want the craggly, gnarly looking carrots from the farmer's market with dirt on them. They came from the ground, and the closer they came, the better, because the stuff that's flown in from 3,000 miles away, those microbes are all long gone. Locally grown food with dirt on it. Support your local farmers, support your local farmers markets. Your microbes will thank you. And while you're out there getting dirty food, it's okay to wash it. Also, get rid of all the hand sanitizer everywhere. Hand sanitizer can contain, depending on what kind it is, a harmful chemical called triclosan that's what's called an endocrine disruptor. It can mess up your hormonal balance. I would much rather my kid eat a little dirt when they come in from the playground than eat these chemicals. So if you're in a situation where you're exposed to sick people in the hospital or in a crowded public situation, hand washing is a great idea. But wash your hands just with a little regular soap and warm water. Wash for about as long as it takes to sing Happy Birthday, one verse. That's how long you have to wash for. And that hand washing will dislodge a lot of the particles that can collect in the crevices of your skin that can cause coughs and colds. And when you think about it, antibacterial hand sanitizers and washes don't protect us from viral organisms anyway. So hand washing is a much better idea. But again, you don't have to be obsessive about it. Just do it when you think it really counts. When you optimize your gut health, you optimize every aspect of your health. And again, I'm not just talking about less gas and less bloating. Improving your gut health can drastically decrease your actual risk of developing serious illnesses, and it can even prolong your life expectancy. So how do we put all the information we've learned today into practice? I want to boil it down for you and start with just 4 simple steps that can make a big difference. The first, drink more water. Remember, I'm a plumber. I'm trying to unclog your pipes. Your digestive tract is one long pipe, and sometimes things get a little clogged. Do what you do if your kitchen sink weren't draining properly. Run some water through it. The second step, add more fiber. Use my simple 1, 2, 3 rule. 1 vegetable at breakfast, 2 at lunch, 3 at dinner. Keep that in mind. I'm not so concerned about what else you're eating, but add in those servings of vegetables. That adds up to 6 servings. The third thing I want you to do is to really consider cleaning out your medicine cabinet. Make sure that you're not taking any unnecessary pills that could actually be hindering instead of helping your gut. Antibiotics and non-steroidal anti-inflammatory drugs are at the top of the list. But be sure to talk to your doctor before making any decisions regarding medications. Finally, I want you to get moving. A quick walk around the block after dinner or some twisting yoga poses during the day can do wonders for your transit time. Remember, if you're not moving, neither are your bowels. Finding your gut bliss by getting to the root cause and addressing it with some simple but effective dietary and lifestyle changes can mean real and lasting relief from the digestive issues that have been weighing you down. There is no better time than right now to get started on the road to optimal gut health. You will be amazed at how many other things in your life get better as your gut function improves. A better mood, clearer skin, a boost in your energy level, fewer coughs and colds, and even a reduced risk for autoimmune disease, obesity, and diabetes. Not to mention the amazing things that are going to happen in your bathroom. I can't wait for you to experience gut bliss. Let's get started together.
My question is, as being a pharmacist for 52 years, the subjects that you covered was very, very direct and correct through my experience. But what do you recommend for the people that are taking purging laxatives that they use every 2nd, 3rd, 5th week to do?
We have a fantastic question from a pharmacist in our audience. What do I think about purging laxatives that people use, what we call stimulant laxatives, that they're using on a regular basis? Stimulant laxatives are never a good idea on a regular basis because the colon can become used to them, and if you stop taking them, the colon can stop working. So stimulant laxatives do just that. They stimulate the bowel to work, and you can become dependent on them. It's a much better idea to use a bulking laxative like fiber that helps to create a bigger stool that passes more easily out, or to use an osmotic cathartic that can draw fluid into the stool. So stimulant laxatives, those purgatives, are not a great idea because the colon can become used to them and the colon can become very inactive after a while. We're going to take another question from our audience.
Yes. Hi, my question is there a such thing as prebiotics, and do they help restore or maintain the microbiome?
I'm so glad you asked about prebiotics, and I want to start with a basic definition about probiotics and prebiotics. Probiotics are live bacteria that, when ingested, are supposed to confer a benefit, and that's a key part of the definition there. They're supposed to confer a benefit. But probiotics are essentially live bacteria. Prebiotics are foods that contain fiber that feed bacteria. And I'll give you an example of one of my favorite kinds of prebiotic foods, and that is sauerkraut, fermented cabbage. So sauerkraut is made from cabbage, which is in itself a high fiber food. And then when you ferment the cabbage, you produce something called lactobacillus, a kind of bacteria. And lactobacillus are very helpful in the gut. So sauerkraut contains not only the fiber to feed your existing bacteria, but also live lactobacillus that have been produced in the fermentation process that are now adding to your microbiome. So prebiotics are sort of a twofer. They're providing live bacteria and they're providing the food, in the case of a fermented food like sauerkraut, to feed the bacteria. There are other examples of prebiotic foods that actually are not providing live bacteria, but are just high fiber foods that feed gut bacteria. So think of the probiotic as the bacteria and the prebiotic as the food for the bacteria.
Explore new worlds and new ideas through programs like this. Made available for everyone through contributions to your PBS station from viewers like you. Thank you.
Be more PBS.